How is the keto diet for bipolar? Okay, keto diet for bipolar, lots of good research, and tons of research on mental health as as a whole, especially depression. I want to say there's probably more research on keto diet than there is depression. Um, but Chris Palmer is going to be your resource for the keto diet and its treatment for depression. He's actually treated patients with bipolar with the keto diet and also schizophrenia. He also has a podcast where he talks about, I think it's with Huberman. If you just look Chris Palmer podcast, I'm pretty sure it's with Huberman, like in YouTube. It might be like it's gonna be long, like 2 hours or so. But but they really go into detail on he has a book, but also his clinic and how he treats mental health symptoms using the keto diet. I'm not an expert in that realm, but I do know that there's tons of research out there and new research every day that is developing. So definitely something to look into and to consider. The other thing I want to mention when it comes to diets and when you're thinking about diets for treating mental health is that you don't want to look at it as a diet, okay, but as a lifestyle. Because if you're going to be using a keto diet, which is a very hard diet to stick to, you have to make sure that it can be consistent with your lifestyle, because if you get out of keto, then there's a possibility that you could end up slipping back into your depression or your bipolar or your schizophrenia, etc. So it has to be something that, like, whichever diet you choose, that's your new lifestyle. So don't look at it as much as a diet but as a lifestyle. So TC says, hello, I have a question about cortisol levels. Is there a way to find out your cortisol level through lab work? Absolutely. And it's not through blood work. So finding out your cortisol through lab work is going to require actually a salivary sample. And so that means spit. and there's a lot of different tests out there. But you're going to want to do one that looks at the diurnal pattern, so that you get your cortisol awakening response and you see the curve. So meaning instead of just doing a morning cortisol, it's going to have you do the morning, midday, afternoon, evening, and then night. I believe it's 5 samples. And then you're going to get your cortisol curve, and then if you also do, so that's like just a cortisol, diurnal cortisol is that test. Lots of labs do them. And then there's like the Dutch Plus, which is going to look at all the hormones plus the adrenal gland hormones like DHEA, pregnenolone, and that's urine and salivary. So it's going to give you the cortisol awakening response as well as DHEA. Now, you could look at your lab work and look at DHEA, and that is going to give you a clue to if your cortisol is dysregulated, if your DHEA is very, very low. Absolutely, that would be a clue cortisol is dysregulated. Also, fasting insulin, that's another blood marker, that would be high. You may also have a high blood sugar, high fasting glucose, hemoglobin A1C could be elevated, triglycerides could be elevated. When you see like that metabolic syndrome pattern, that could be related to high cortisol. And so if you want to kind of dial in on where the cortisol is peaking and you want to know the time, like if you know, to try to treat it, if that's like the main issue going on, then doing the salivary cortisol test could definitely help you to pinpoint where that is. But you have to look at that in the whole big scheme of things, as far as, not just looking at cortisol, but, looking at adrenal function as well. Okay. Elias, What are your thoughts on light therapy for depression? So light therapy, good question. Can be very effective. Lots of studies show that it can be effective, and oftentimes is effective because of something called seasonal affective disorder. So seasonal affective disorder is when you have the depression come like in the winter time. So you live in a place where there's not a lot of light, and we have the daylight savings time, and so we go back and we end up going as far as backwards, as far as not getting enough sunlight, right? So now there's more darkness. And so light therapy is very beneficial. So if you notice your depression is cyclical with the change in daylight savings, with the change in sunlight, or if you're in an area where you're not getting a lot of sunlight, maybe you're in Alaska, etc., then yes, light therapy for depression is way more effective than any other type of depression. But yeah, so light therapy can be effective, like I said, for seasonal affective disorder, and those living in areas where you're not exposed to a lot of sunlight. That's where I would definitely leverage light therapy. As far as leveraging it for other types of depression, like a chronic depression, maybe you might get some effectiveness, but it's not going to be as robust as someone who has those types of, like, the cyclical depression that comes and goes with exposure to light. How long to wait before you can drink citric acid juice after taking Vyvanse so it stays active? Good question. So 2 hours. You want to give it at least 2 hours in the gastric intestinal, especially Vyvanse. Because Vyvanse's metabolism occurs through that membrane of the gastrointestinal tract and through the RBC, through the red blood cells. So there really isn't a lot of liver metabolism going on. So 2 hours minimum, 3 to 4 to be safe if you're a slow digester. But if you didn't take it with food and you just drank it, say with water, then 2 hours should be fine.